The NMDOH Consortium is a statewide effort aimed at advancing the integration of non-medical solutions into the healthcare delivery system so that we can improve health outcomes and reduce health disparities across the state. Our first year showed us this work is needed and timely. There is growing momentum across the state around the integration of NMDOH into the healthcare delivery system. We're seeing health plans, providers, and health systems invest in non-medical interventions on behalf of their patients. And in response, a growing number of community clinics and health professionals are implementing a variety of programs to improve conditions that have a negative impact on the health of their patients. The Texas Consortium is a dedicated space for all stakeholders to come together to share, learn, and support what is working, and to build a field of practice for NMDOH in Texas. At the end of last year, early this year, we're focused on populating our program index, which we launched at the end of last year. This is a tool to catalog NMDOH programs, which are services and resources offered to patients of health system organizations like plans, providers, and hospital systems. The index features abstracts of programs with searchable fields, including program sponsorship, drivers of health, target populations, health conditions, location, and evaluation status. Our goal is for this index to serve as a resource for anyone working in this space to know what is happening, what is working, and with what costs and benefits. But the program index will only be as robust as you make it. So I'd like to invite you to carve out 15 minutes of your week this week to check out the index and send me an email to get the ball rolling on showcasing your work in the NMDOH space. The link to the program index is in the chat along with my email. And of course, I will offer that again at the end. Now let's get to our session for today. Today's presentation about the Community Resource Referral Platform, Findhelp. We will have time at the end for Q&A, but feel free to put questions and comments in the chat throughout the presentation, and we'll make sure to address each comment. At the end of the meeting, I will put the link to the program index in the chat again and encourage you again to bookmark and send us your abstracts. Now I'm excited to introduce Emily Parmelli, Director of Customer and Community Success with Findhelp, who will introduce our speakers and kick things off today. Over to you, Emily.
Awesome. Thanks so much, Jackie. And I'm going to share my screen really quickly, folks. Great. Give me one moment. I just want to make sure you're seeing the right screen. This one we want to show. Perfect. Awesome. All right, folks. As Jackie said, we're really excited to be here. My name is Emily Parmelli. As she mentioned, I serve as the Director of Customer and Community Success here at Findhelp. We're really, really honored to be here. Thanks again to Jackie and the consortium for having us. Before we jump into the presentation, as Jackie said, I do want to go ahead and let the stars of the show, a couple of our community partners, introduce themselves. Susanna, would you like to share with the group who you are and the role you play at Texas Children's Health Plan?
Yes, of course. So my name is Susana Rendon. I am the Community Health Manager at Texas Children's Health Plan. We have our population health department where we screen our members and outreach our members for our NMDOH needs.
Jody, would you like to introduce yourself to the group?
Oh, Jody, I believe you're on mute.
Okay, sorry about that. My name is Jody Perry, and I'm the Family Database and Routing Manager here at Kids Meals. And at Kids Meals, we address childhood food insecurity by delivering sack lunches directly to their homes. I'm just excited to be here.
Perfect. So before we kick off today, folks, I am going to do a bit of introduction just around Findhelp. I will do a platform demo today as well, but then really want to focus the body of today's presentation on testimonials from both Susanna and Jody about their experience leveraging Findhelp, and we will have robust time for questions and discussion as well at the end. If you do have questions throughout, feel free to drop them into the chat. I do have it up and I'm monitoring. I'll do my best to kind of answer those questions throughout where it makes sense. But like I said, we'll also have that time at the end. So again, just to kind of introduce Findhelp, right? You can see on the screen our mission and vision. Findhelp is a software company, but we're also a public benefit company that serves the nation. As we're making decisions kind of 20 years out, our goal is to solve the core information problem of what services someone is eligible for and offer a direct connection and response through technology. Digitization of social care and referrals are just sort of one example of advancement we've seen in the past few years. We tend to show this graph to leaders nationwide that shows how referrals are really coming to life through technology platforms like Findhelp. And the work we're doing with customers and community-based organizations across the country is scaling, and we have some great evidence. Just over 36 million, users nationwide, 610,000 program locations, just over 105,000 of those programs in network and partnering with us like Jody's and Kids Meals. For those of you local here in Texas, which I saw a lot of folks in the chat were, specifically here in Texas, our network is strong. We work with systems to payers, to community colleges and nonprofits. As you see on the screen, 3.2 million users in the state of Texas alone. As a software company, there are three major areas of design and development that we focus on. First is needs identification. It's critical that we bring together the needs a person may have with the programs they're eligible for through either government or perhaps their insurance provider. Network curation is our second theme. It's more than just free and reduced cost direct social services. We also help build contracted networks where CBOs and other nonprofit organizations are being funded for their work, as well as retail networks where we're focused on goods and service delivery. And lastly, case management. We make it easy for CBOs and others to do case management, not just because we offer free tools for them to use in the community, but also because we support flexibility and interoperability for them. And I think we can probably all agree that we're really just in the first inning of social care technology and adoption in the US. And we're already seeing appetites for development of focused networks of programs on some of the things that you see on your screen: behavioral health, maternal health, crisis assistance. We know that we can have an immediate impact because we're able to build direct connections into these spaces. And as I jump into the demonstration, I wanted to share some things maybe to be thinking about when it comes to resource and referral networks that we've learned over the years really help to gain community level trust and support adoption. A couple examples that I'll call out from what's on your screen: providing strong self-navigation. This is important so people can explore their options independently and privately. We believe the system must serve all people, so reading level and disability compliance, as well as responsiveness of the app, must be part of our development. We consider ourselves and must be industry leaders in social care privacy and consent, as well as integration and data exchange. And we must respect nonprofit autonomy, meaning nonprofits and other community organizations should be able to choose the tools that are going to work best for them and their work, and still be able to receive and respond to referrals as they need to. Now, I am going to jump over to our demonstration, and I'm going to show you a couple different views here. So bear with me. The first view I actually wanted to show is Texas Children's site. So Susanna will talk more about this, but this is TXCH Family Resources.org. This is a site that is available to any and all members of the community who are looking to search for resources. And I'm going to use this site for the first part of our demonstration just to show you what it looks like to search for resources on the platform. So I pulled up a zip code here in the Houston area, and I'm just going to click search. You can see right away what comes up on our home screen is that there are 3,392 programs that support this zip code. I'll orient you to a couple other pieces of information you're seeing on your screen. First and foremost is our navigation bar that you see at the top. This can be used, and I'll scroll through to really look for different services underneath some of these top categories based on our open eligibility taxonomy. What's also available though is keyword search. So anyone can search for something like food and easily access specific programs or the search tag itself. Before I move on from this home screen, I do want to show one other example of our standard navigation bar here, but where I was talking about the ability to create custom networks that may serve specific populations. I wanted to briefly share our partner AARP Foundation's platform. They specifically focus on social isolation for the senior population, and they've actually customized their navigation bar at the top to serve that population best. So you can see it's a little bit different, a little bit smaller than our standard navigation bar. Really, really important and critical as we think about serving specific populations of need. Jumping back over to the Texas Children's site, I'm going to show you how you can actually find a program and refer to it. I'm first going to do that by actually finding Jody's program on the site. So I'm going to search Kids Meals Inc. and click the search button. And you can see there's Jody's program. It looks familiar to her. They offer meal delivery, as she mentioned, in 46 distinct zip codes throughout Texas. And what I'm not going to do is actually show you the search and referral functionality on Jody's program because this is live. She will receive the referral, and I'm not actually referring anyone for services right now. So for demonstration purposes, I'm going to jump over to a demonstration platform and just show you this looks exactly the same as the program we were just on for Jody, but it will allow me to make a referral to it. So this is our job supports program, just to quickly orient a little bit more around what you're seeing on your screen. We do have the program description here. We cover main services as well as the population that this program specifically serves. If you click this drop down here, you'll be able to print out this program if you need to give it to somebody as a takeaway. You can also see more information about the program. So again, a detailed description, more information on the coverage area, as well as some of the main office locations and hours. Now, if I was working in a case manager capacity, I was referring someone to services, I might want to go here and click apply. Why this button says apply is because this program actually has a Findhelp eligibility screener configured on it. You saw that Jody's program also has that eligibility screener configured. And why we have those is to allow for nonprofits and other community organizations to get more information about an individual to determine if they meet the eligibility criteria of the program, or just to expedite the process of getting them connected into services. So to kind of go through the functionality here, I'm going to choose that I'm referring someone else. You can also choose the option that you're referring either yourself or a member of your family. But for our purposes, I'm acting in a case management capacity, so I'm going to choose referring someone else. I am going to refer just a demonstration profile, and I've referred Marnie member before, so it's going to pop up and save me a little bit of time in pulling their information through. If I was perhaps working at Texas Children's Health Plan and I knew this member's member ID, I could put it in the field here, not required. I'm always going to choose the best way to reach Marnie so that the community-based organization has an understanding of how they may like to be contacted. For our purposes today, I'm going to choose phone call. I can also add a comment. This is really helpful in communicating with the community-based organization. I might want to say specifically with our job support program, Marnie is in need of technical support. This just gives the community-based organization a little bit more of an idea of what they're looking for as far as services. Always going to confirm consent that Marnie knows that this information is going to be shared with the job supports program. That's critically important to ensure that everyone knows where their information is going. And then I'm going to click the next button. This is what's going to take me to the screening program. And this gives me, again, it's going to auto-populate Marnie's information, but it's going to ask a little bit more information about her. So I'm going to go ahead and just enter that she lives in Main Street, Houston. Oops. I'll select Texas here and zip code. This is fully customizable, so any questions that an organization may need to ask can be reviewed. And I'll submit this form. What's going to happen when I'm submitting this is three things. First, Marnie's going to get a confirmation that a referral was sent on her behalf. Again, we always want to ensure that patients and members and clients are aware that we're making a referral for them and where their information is going. Second is I, as the case manager in this situation, will receive a notification, as well as I'll show you in a second how you can actually access the profile for Marnie and the referral we just made. And then thirdly, the job supports program is going to get a notification that they have a new referral. I'll also show that view briefly so you can see what it looks like for a community-based organization to receive a referral. Jumping quickly into our second scenario here, where I am supporting Marnie as a case manager, I want to check out the referral I just made for her. So I'll go into our People I'm Helping page. I'll quickly find Marnie here and open her profile. And you can see a couple things on the profile here. So I can, of course, see Marnie's personal information. I can see if she's a part of a household, if there's multiple folks within the same family who are being supported. I can see any assessments or forms that have been filled out on her behalf. I can also upload documents here. This might be a license or a proof of insurance. I can also see all the referrals that have been made on Marnie's behalf. So here is the referral I just made. You can see a couple things here. It's to the job supports program. I can also add a note for myself here if I have case notes or pieces of information I want to remind myself of later. And you'll see that the status right now is marked as not updated. We just sent this referral over to job supports. And so if I was perhaps meeting with Marnie later on, I could update the status of this referral based on these fields, but I'm going to leave this as not updated for right now so I can show you what it looks like on the nonprofit or community-based organization side. So really briefly, I'm going to jump into my inbound referrals dashboard here, and I'm going to head to my job supports program. Again, this is what it looks like for a community-based organization who's received this referral. I'll click into job supports. There we go. And we'll see Marnie's referral pop up right at the top here. Couple things the community-based organization is going to see. They're going to see, of course, Marnie's information. They're going to see that I marked that she prefers a phone call as far as communication. They're going to see that she speaks English as her primary language. And they'll be able to see information that I referred her, when I referred her, and where the referral was last updated. They'll also be able to see the screening form that I filled out for Marnie. So again, that additional information that nonprofits or community organizations might need is right here at their fingertips. Heading back to the dashboard here, a couple things I can do from this view. I can view Marnie's profile that I just showed you. So all of the same information is accessible to the community organization. I can also view the comment that was left, right? We said that Marnie might need technical training and support. That information's passed right over to the community organization. And lastly, I can update the status here. So let's say in this scenario, work at the Job Supports Program, I've determined that Marnie is eligible for the program. And that information is now passed over to Marnie's profile and is visible for me as the case manager. So I'll show you that really quickly. Going back to Marnie's profile, we'll be able to see that the job supports referral here is now marked as eligible. So it's as simple as that to be able to see and communicate between healthcare organizations or other folks working in the community to support community members and nonprofits and other community organizations. Before I wrap up to my last couple of items I want to show you around to, I do want to comment on our data collection forms. So this is a key element that as we have healthcare providers partnering closely with nonprofits and other community organizations, sometimes just knowing that the referral is perhaps closed, that Marnie got help, we might need a little bit more information than that. So we offer configurable data collection forms that allow nonprofits or those helping in the community to share even more information about how they helped that person or in what quantities in some cases. So for instance, and again, this is completely configurable, you'll be able to see the data collection form or an organization can configure this data collection form and share that they provided technical training. And for instance, mark whether they need a follow-up. We'll say no in this case, and we will submit. Now, this information can also be viewed in reporting and is available to both the community organization as well as the healthcare provider if the right data sharing agreements are in place. Last couple things I want to orient y'all to or show related to the Findhelp platform. First is assessments. So I'm already in Marnie's profile here, just to make this a little bit quicker. But we do offer configurable social needs assessments, which tend to happen pretty commonly in our field today and are critical in understanding what needs an individual might have. So I'm going to show you a little bit of what this looks like. Because I'm already in Marnie's profile, I don't necessarily need to fill in any of this information about her. I'm just going to include her zip code. This is a general social needs screening, so I'm going to answer some of these questions. Just going to do this very briefly so you can see. I'll submit this. I need to consent. And what this is going to pull up is some options for Marnie based on the social needs screening that I did, the social needs she may have screened positive for, and her zip code. So this is going to be a specific context where we're recommending programs based directly on the assessment results that an individual may have received. So you can see there's a few options there. And lastly, before I turn it over to our partners, Susanna and Jody, I do want to briefly touch on analytics. It's critical for our understanding of social needs to know what's happening in an area. And so one of the things that Findhelp prides itself on providing is a robust analytics suite. I just pulled up one example here where, for instance, we can see search trends in a particular area. So we can see both the number of searches that occurred in a specific area, the categories of those searches, the specific search terms that were being used, top 5 searches over time. And this is my favorite one. We have a heat map where it actually shows, this is across the United States, but you can always zoom in to a specific area to see where searches are happening. We have more analytics that I know folks may be interested in hearing more about, but for today's demonstrations, I wanted to show just this piece. With that, I am going to jump back over to our slides. And I would love at this time to turn it over to Susanna to share a little bit more about Texas Children's Health Plan's direct work with Findhelp, and keep those questions coming. I see them in the chat and I'll do my best to answer as we wrap up. Susanna, take it away.
Thank you, Emily. So like she said, I am from Texas Children's Health Plan. We've used Findhelp for a little bit over 2 years. We are not only using it within the health plan, but also with the Texas Children's Organization, which we have several hospitals throughout Houston, including Austin now. So we were searching or looking for a platform that was gonna basically do all that work that we need to when we're screening our patients for an MDOH need.
Yeah.
So with Findhelp, we found that they had not only one source part of CBOs, but anything from housing, financial, transportation. We had all that. As a health plan, it has worked great for us, where it's easy to use, and then we are able to refer these members in a quicker and more time efficient way. When I started 2 years ago in this department, I started working at one of our clinics where we were referring members based on food insecurity. And that's when I got connected with Jody. Back in those days, we weren't very active with Findhelp. So what we were doing, we were giving our members a paper application for Findhelp. What our members don't do, they don't turn in the applications, therefore they don't get that resource, right? So when we started using Findhelp, I got with Jody and we discussed what would be the best way to refer our members and for them to get this their need, which was kids meals, which is food delivery for kids under 5 years of age, and in a pediatric clinic that is very helpful. So once we got with Jody, we decided the referral button was already initialized in Findhelp, which made things a lot more easier. Our team got together. We started referring members left and right to Jody, and I know her numbers increased while we were referring those members through Findhelp. So it made it a lot easier for our members to get that resource that they much needed. Not only that, but the feedback we were getting from our members, because our department does follow-ups with our members. The feedback that we were getting from our members was great, where it told us that this referral button is working. Not only was it working, but it was helping our members get those resources in a timely manner. If they had any issues, we were able to see that through the analytics, through the member's profile, whether they received the help. Maybe there was a hiccup on our end or a hiccup on Jody's end, and we're able to communicate with Jody, having a closer relationship with her because of Findhelp and having that open communication with her department. One of the things that also I love of doing with Findhelp has been the analytics portion, because obviously not only are we in need for food insecurities, but we also have housing. We also have financial needs. And as a leader, you want to try to pull those analytics and see what are your top CBOs that we are referring to, and what type of CBOs are we referring to, right? So on our end, we're able to determine what can we do to continue growing those relationships with these top CBOs. And we're working on what type of relationships we're building with our CBOs, what kind of incentives we might be able to produce based on how we are referring to these members, how the organization or the CBO is getting that information, and if they're being active with what we're giving them. I think the best thing about Findhelp is being clear and open and transparent and seeing what on your site you're doing and what the CBO is doing. Back in the days, it was just, based on, verbal confirmation. Yes, I got it, thumbs up. But now we're able to really see and if you're a data person, pull that data and get your numbers and, present to your upper leadership and see what can we do to make sure that our members, our patients are getting that resource that they need based on these analytics or data that we're getting from Findhelp. In the future, I know, well, Texas Children's, not only with the health fund, we're pretty big, we have several locations throughout Houston. So having one platform that we can use as the health plan, as the hospital, as the clinics, and being able to communicate with each other has been great, because not only are we able to see whether I referred them, my team referred them for the health plan, but we can see whether the hospital or the clinics referred them as well, to see that number. That is all I have for my portion. It's easy to use. One of the things, like everything that Emily was showing, I can testify that I've used every single portion of that and it works. It's very easy with your zip code. Another thing that that Emily didn't mention, but you're able to filter through the zip code, and also as your organization, you're able to, if, for instance, for us, we have Findhelp as our feature program, meaning that whenever you're looking for, Findhelp, Kids Meals as a feature program, meaning that whenever you are anyone within your organization that uses that platform and is looking for food delivery, Kids Meals will be on top, because it's a trusted and feature program that we've used and we've testified that it's that works for us. Another thing which I like, we have members and patients that speak several different languages. They're able to customize that platform to whatever language they have, whether it's Spanish, Vietnamese, any other language, French, whatever you want to put on there. You can use that. And when we are referring our patients, there's several ways that they can get the information, whether it's email, whether it is through a printed portion if you're face-to-face. My team is work from home, so we do mostly emails that we send our members, and they can just click on the hyperlink and it'll direct them specifically to the program that we referred them to, and they're able to get all that information, how to contact the program. Obviously, if we send it to them, they're eligible for the program. So they're able to have all that contact information within a couple of minutes of us sending them that email. The only thing I do have to say, that we do have to educate our member that, obviously they don't get emails from Findhelp often, so it'll go through their junk mail. So that's one thing that I would suggest, that whenever you do use the email option, make sure that you educate your patient, your member, that they're going to find that email through their junk mail, just because they've never received anything from there. Texting on the health plan side, we don't do texting, but I know at the hospital they are able to text, and texting, obviously, it works a lot better and faster for our members, because they get it right in a text, they click the hyperlink, and they get all that information right away. Jody, do you have anything else to add?
Yeah, we'll jump over to Jody, and I just want to thank you so much, Susan. I want to do an extra plug for Texas Children's community site, which is here on the platform, or I guess on your screen. Anyone can use this. It's completely free of cost, accessible to the community, and wanted to make sure we shouted that out before we jump over to Jody. Jody, would you like to share more about Kids Meals and your work with Texas Children's?
I would love to. I'd be happy to. And so thank you. So Kids Meals, at Kids Meals, we addressed childhood food insecurity for children between the ages of 0 and to 5. And so these are children that don't have access to the National Free School Lunch Program. And we go out Monday through Friday and deliver lunches to their homes, apartments, trailer homes. And so now we have over 8,000 kids between those ages with their siblings. That brings it up to 15,000 kids, I'm sorry. And so we feed them on the school holidays and summers. So if they're on if the smaller child is on the program, they're older siblings also benefit from on those days. And we are in 46 zip codes in the greater Houston area. That's with 17 drivers. They are staff drivers, but we do work a lot with everyday volunteers are here to helping us to make these sandwiches and pack the lunches. There are 4 items. It's a healthy sack lunch, and it's a protein, a drink, a fruit snack, and another little snack. So with that, as we also offer our wraparound services, resources. And so that we partner with other social services to be able to share those with our families through flyers and posts on our Facebook, just different items that they might have that we can pass out during our deliveries. And so when we first before Findhelp, we heard about Aunt Bertha through AmeriGroup. And so we said, oh, this is great. It's great to refer families to these resources that they need. We do survey our families to find out kind of what types of resources they need as well. But this is a great way for us to this is just a speedier way for us to get these resources to the families. And so, but Texas Children's Health Plan representatives came to us and to talk about how we can collaborate and really help more families quicker. And so we decided that the best way would be to have our application on file with their representatives to be able, and they are able to fill that out for the family. So that was just so wonderful. And they also email it directly to us. And so once we do that, we can keep up with that work, put out in our workflow, and make sure that we let Findhelp know that so she goes. We have Susan and Guadalupe Fraga. We have a couple of representatives from Texas Children that send us applications filled out and signed. Once we have that, then we can go into Findhelp and also into our Apricot system, which I'm a family database and routing manager. I maintain that Apricot database system so that we can run reports and demographics and resource referrals, grant reporting purposes as well. So it goes into our Apricot, and then we also have a workflow to make sure we let Texas Children or whoever refers to us that we got help, and we can also keep track of that. We love that feature. And so we have, so sometimes, like Susanna was saying, is that sometimes we can't get a hold of family, or something happens that we weren't able to deliver, that she will let us know. The families must be really close with Susanna because they let her know. You have a great connection with them. And so they will let her know, and then, it's on our radar at that point. And it's just been working out really well between us. If we don't get a referral from Texas Children, then and it's from an individual, we still we have another process for that. Would you like to hear about it, or
Yeah. So
okay.
I think, Jody, thank you so
Sure.
much.
Okay.
What I'm going to do actually is stop my screen share so we can all see each other, because I do want to make sure we have time for questions. I have a couple. I know my colleague Jaffer is jumping in to our chat to answer some of the questions that were popping up there. So keep those coming, but also please unmute and ask some questions. I do have a couple questions that I had that I thought would be good to prompt some discussion here to get us started, so we can hear from both Susanna and Jody. And I think first, kind of a question for both of you, and maybe Susanna, I'll have you go first. If there any lessons you'd share with those who are considering Findhelp for their own organization? What might you say? I know you had mentioned making sure that clients are aware that they're going to receive an email from us and they may need to check their spam for that. But any other kind of recommendations or lessons you would share with this group?
I think I had that. It's just, it has made the process a lot easier for us to refer our members. I think, like I stated earlier, back in when I started in this department, it was paper applications to Jody. Obviously, those applications were not getting turned in on time or turned in at all because a lot of our members or patients, you know, hesitate to do things like that. Either they don't have access to email, they don't have access to a fax, they don't have access, or they don't know how to do any of those. So for us to do it on their end and having the Findhelp app to guide us and smooth out that process has been better for us to assist our members, assist our patients. And I'm sorry, I talk members and patients because we're a little bit of both, right? But I think having Findhelp and assisting us has been very helpful for us, has been tracking those referrals has been one of the best things because like I said, our field relations coordinators, which I have a couple here on the call, they do follow up with our members if we send them resources. And if a member, for instance, if Lupe or Guadalupe calls a member and they state that they didn't receive their meal and we referred them about a month ago, we go back, see what happened, and we get in contact with Jody's team. Hey, this member states they didn't receive the meal, but what it's best for us is that we can see the tracking on Jody's side, whether she updated or maybe that member fell through the loop and they weren't able to get to that member, right? So we're able to see that, and then we have more of a clear picture. Also, we have built a more open relationship with Jody's team. We have had that open communication, a trusting relationship where I know that what I'm referring to, they're taking care of. And having that open communication, trusting relationship with them has been a big deal for us because we know that our members, our patients are getting the assistance that they want. Lessons, I feel like is just, it's been easier for us. It's been less of a headache to, getting our members there. And the only one thing that I have to say is like, make sure that we are teaching our members or educating our members to look through that junk mail if you are sending it via email. Like I said, on the health plan, we are not really able to text, but the hospital and the clinics are able to text. So texting would be a lot easier for those that can.
And Jody, what about you? If you're thinking about other nonprofits or community organizations who might be considering using Findhelp, what lessons would you share with them, or what perspective?
Right. Well, one thing I wanted to mention too is that on our family intake application, we do have a line that for organizations that are referring to us to put their name there. So that just helps us to keep track as well once we do get those applications in. And Susan is really good about doing that. And I think, it's just the analytical features that we can use is really great. I'm a maps person, so I really love the maps to show us kind of like the areas, which areas what their needs are specifically, and we can cater to that as much as we can. We also, okay, hold on. Another thing I wanted to say was we have these postcards that have a QR code on it that it was just a great setup. When we first got started, our engagement manager helped us with our setup process and training on going around the navigation of the platform. So he's been wonderful. And I really learned that these platforms are here, for our use. And that's one of the biggest things that that we learned here. But we really like these because then we can go back and track where, you know, families that are searching that came from our organization.
And yeah, what Jody's holding up is a Findhelp postcard that, yes, you can use the QR code to access findhelp.org. We do have those available. So if folks are interested in just having them, they're great patient resources, can just be takeaways for folks. We can get those out to y'all in follow-up if there's any interest. Awesome. I see there are some questions that are getting answered in the chat, but I saw Lori, you had raised your hand. Do you have a question for Susanna, Jody, or the group?
Yes, and forgive me, there's work going on in the background, so I forgive the noise. What is unique, because there's so many different platforms out there, like Unite Us and different things. What's unique that this one really stands out as a tracking tool or a communication or a loop back referral system? What's unique here? Because it's really hard for providers to decide which platform.
Yeah, that's a great question, Lori. And I'll answer, but then I do want to let Susanna and Jody maybe share some of their perspectives as well of what might be unique to Findhelp, and for Susanna specifically, kind of reiterate or share more of sort of what came into Texas Children's Choice in leveraging Findhelp. What I'm going to do really quickly is bring back up my screen here, because I do want to go to the principles that we talked about. Let me actually do it the right way so y'all can actually see it. That would be helpful. Give me one moment here. Here we go. Awesome. Just checking, can y'all see the principles slide? I want to make sure it's pulled up. No, okay.
No.
Not yet.
All right. I will not worry about the screen share. Maybe I can, we'll of course send these in follow up, but a couple of the things I wanted to reiterate, right? You saw that we were searching, and Jody has those lovely postcards on findhelp.org. Self-navigation is so critical. Findhelp is really the only platform that allows our customers and partners to have community level sites as well as staff facing sites. So the ability to support community members in navigating anonymously and directly is critical to ensure that they can explore those options independently and reach out for help when they're ready. I think the other piece that we talk quite a bit about is privacy and consent. We have a consumer-directed consent model within Findhelp. You saw me check the box for consent on every referral that we send. It's important that folks know who their information is being shared with when, and that they consent to that. So with Findhelp, again, an individual's consenting to each referral that's happening across the platform. It's not, I sign up for the platform and my information sort of shared in perpetuity. That kind of privacy and individual consent is unique and critical to the community. And then lastly, I'll double down on nonprofit autonomy. Jody mentioned they use Apricot. It's incredibly important to us at Findhelp that we are building the right levels of interoperability and integrations into systems of record that nonprofits and community organizations are already using. Where an organization doesn't have a system of record, Findhelp has those free case management tools that I showed you, our inbound referrals dashboard and the like. But where an organization has already invested time, money, staff resources in another tool, we want to support that choice and allow for referrals from Findhelp to integrate into that existing system of record. So we have active integrations with Salesforce and a number of other common nonprofit tools to really support that CBO choice and really ultimately support adoption, because it's much easier for them to sign on and leverage the tool if it's possible for them to receive those referrals in that chosen system of record. But just to kind of pause, Susanna, Jody, what would you add? What might be unique about Findhelp that swayed your interest?
Well, one of the things, and I don't know if it would be unique, but one of the things that I liked as well as Findhelp, that on Findhelp, that not only can the staff use it, but our members and patients can use it as well. And as easy as it is for us, it's easy for them. So we have within the Texas Children's Hospital website, we have an area for resources where they're able to click on Find Help, and they're able to find for their own resources. Because not a lot of members or patients or members want to call us, or they feel more comfortable doing the search on their own to tailor it more to their needs, more than we can, I guess. So they're able to do that as well, and do it on their end. Other than that, that's the other little thing I wanted to share.
I can add a little bit. And again, I don't know if this is unique either, but there is on the cards after your organizations make their cards, there's options to be able to apply directly, or have a link directly to your website or your organization. It tells you exactly. It tells the people that are looking for help exactly how they can follow up with the organization, and I think that's just wonderful. And it just it really helps our workflow too. And when I'm not a social worker, we just hired a social worker last year, and so she uses it as well for her tracking. And but for everyone else in the building that is trying to help someone, they might not have the social worker there. We can just go in there and refer them in that way.
And there is a question in the chat that I would love both of your perspectives on. Jolene asked, can Jody and Susanna share more about their experience with technical assistance and support with Findhelp? I know, Jody, you had mentioned working closely with Eric, but will both of you just share a little bit more about your experience with kind of that technical assistance and support?
I mean, yes, quick response whenever I have a question of how to get around on the platform. And Eric, he reaches out to us to see if we ever need anything, and I think it's very transparent and accessible for that help.
And same with us. We have Eric and we have Matt, where we have meetings with them. I think now we've moved them monthly, just because we're getting a little bit better with using Findhelp. But we do have meetings with them, and they're able to either, if we need training in, for example, a couple of weeks ago, we needed training in how to use the analytics, how to use that data to our advantage, right? Eric was able to provide a very simple training to show us what these analytics can do and help us get the information that we need. I'm sorry, Matt was able to do that. Eric, whenever we have the meetings, they're both there, right? Eric helps us a lot with, trying to reach out to more CBOs, trying to get more of these CBOs to be aligned. We kind of want all of our CBOs to mirror what Jody's team is doing, because that just makes our life a lot easier. It makes our case managers, our social workers, and our FRC team, refer our members to their organizations. So Eric helps us with that, and he gives us data with, what are our top CBOs, what else can we add to our platform. So they have been very helpful whenever there is a let's say that there's an outage or there's an update within the platform. Findhelp has been very, very what's it called? Very their communication is very open. We're letting us know, hey, it's not going to be, we're going to do an update. It might be down from this time to this time. And then they'll give us an update. Hey, it's been updated. You're free to use the platform whenever you, as soon as you want. So technical difficulties, we really never had any, because they jump on board before we're able to experience them. But we always have Matt and Eric to help us with any questions that we might need, and they're very prompt into answering those questions.
Lovely. Thank you both for that perspective. I'm looking at our time here, and I believe at the 57 mark, we're going to turn it back over to Jackie to kind of close us out here. So I'm not sure we have time for more questions, but I know that Joffer has been diligently answering many of them in the platform, or excuse me, in the chat. So Jody, Jackie, I might turn it back over to you with about 30 seconds to spare to close us out, just so we stay on time and respect everyone's day.
So you want to turn it over now? You guys can do another question if you want.
Oh, perfect. I wanted to make sure that we weren't we weren't stepping on your time. So quickly here, I think the one that I saw that didn't quite get an answer that I wanted to touch on was Lori, I think you also asked how we're IDing those who aren't eligible for government funded resources and how we're ensuring that those services are going to the right families. When I was showing in the platform, and this is something that I'd love to screen share. I'm having some challenges on my side, so just working with my own technical difficulties. But we do have the ability to filter for the specific programs that might have income eligibility requirements or other sort of requirements. So as you're searching through the platform, when I showed the program card piece, we also have the ability to filter out where folks might not be eligible for certain services based on things like FPIL or the federal poverty income level. So we'll make sure that folks get a link to that in follow-up. We have a nice support article that goes over that, but wanted to make sure we got that question answered because it's a common one. All right. I think that wraps up our time, Jackie. And folks, really appreciate all of the questions. Really thoughtful conversation happening in the chat as well. And on behalf of myself, Findhelp, and hopefully Susanna and Jody, if they'll have me, we have been really, really excited to spend the morning or afternoon with you. And Jackie, would you like to take it away and close us out?
Yeah. Thanks, Emily. This was a great presentation. Jody and Susanna, your testimonials are so helpful to people who are trying to make a decision and what community resource referral platform, or if one, will help them out. And it sounds like it's had a really great impact on each of your organizations. So thank you for making the time today. To everyone else, thank you so much for joining us today. Again, we are seeking NMDOH program abstracts from health organizations for our program index. So I'm just dropped the link in our chat again with my email. Take 15 minutes to review the program index. And if you have programs, which I'm sure most of you do, reach out to me and we'll get the ball rolling on getting your work showcased. Thanks again and have a great day, everyone.
Thank you.